Hello everyone, welcome to week 14. I took care of my patient last week. My patient is a 54-year-old Caucasian female. This is her first time to see my nurse practitioner. She has been waiting for almost 2 months to see my nurse practitioner. When asked what brought her to the office that day, she said, "I feel drunk all the time and I do not even drink." She reported that she feels out of touch with reality and she needs help. Okay, a little bit background on her. Patient lives alone. She says she had never been married. She has 3 children. They all live in the same area, but she's not close to them. Her sister lives 3 doors down to her, and they are very close. She came with her sister that day. Patient reported that she doesn't have many friends, but she's okay with it because she's a loner. For medication, patient said she was treated with Prozac about many years ago, but she had not been taking it. Okay, so like I said, both she and her sister said she had been acting strangely, so that one of the things that they wanted her to be seen. They were afraid or embarrassed to go to the ER, so they waited all that time to come and see the nurse practitioner. Okay, now we'll go to the DMS-5. Patient is alert and oriented time 3. Her affect is flat and anxious. Patient is unable to describe her mood. She denied anxiety, but she is anxious. She's walking up and down. She denied hallucination and delusions. She said her memories have been good. She denied any thought of hurting herself. But the night before, she cut her wrist with a kitchen knife. And her sister did not take her to the ER again because she said she didn't want to. So she still has it's deeper than superficial wound on her wrist, on her left wrist. Okay, for eating, she said she had been eating everything. And for exercise, she said she had not been thinking about exercise. She had not been functioning to even think that far. Okay. So for the DSM-5 ISIS-1, major depressive disorder, that what she had been treated for. ISIS-2 is deferred. ISIS-3, she had no medical condition. ISIS-4, the psychosocial and environmental factor. Patient has never been married. She lives alone. She lives 2 doors down the street from her sister. She had 3 children, but they do not talk to her. She says she's a loner, so she's okay with not having a lot of friends. For ISIS-5, the global assessment functioning, I will give her 38. Patient is really struggling. She seems to be confused. She appeared confused to me. She had not been able to function as well. She says she feels drunk all the time. For my differential diagnosis for this patient, I would say acute psychosis because of her bizarre behavior, going to other people's house and asking them to leave her house, even though it was their house. Okay, so what would be the plan for this patient? Well, the patient, like I said, she's not on any medication because of cutting herself, the poor sleep for almost 5 days, the bizarre behavior, is particularly going to somebody else's house and asking them to get out of the house and not sleeping and just not able to function. My nurse practitioner, we are going to refer her to the ER. We physically walk her to the ER to have psych evaluation. She could be because my nurse practitioner want her to be inpatient, so that's why we are taking her to the ER. She has to go to the ER to be admitted inpatient in the same hospital. Okay, my references as the American Psychiatry Association 2013 and Stoll's Prescriber Guide 2021. Thank you.